Hello, and thank you for joining us to learn more about the Planning for the Next Normal at School Playbook, Social Drivers of Health chapter. Today, we'll briefly walk through the Social Drivers of Health chapter checklist, highlighting a couple of plays or key strategies and resources to support activating social drivers of health in your school community. I'm Flora Daniel, manager of Kaiser at Kaiser Permanente, and I'm joined by Lori Stradley, co-author of the Social Drivers of Health chapter. Thank you, Lori, for joining us today for this conversation. And if you don't mind, to start the conversation, you share a little bit about your background.
Thanks, Flora. Again, my name is Lori Stradley. I serve as the Chief Program Officer at Alliance for a Healthier Generation. My career has been focused on health and well-being of young people, with attention to the systems and the people that surround them. Social drivers of health are a critical piece of the puzzle that have often been left out of the conversation around child health and well-being. Even more critically, inequitable access and opportunities as a result of systemic racism within social drivers like housing and good food are driving inequitable health outcomes. One of the many results of the COVID pandemic was greater understanding of the influence that schools and districts have on a child and their family's ability to thrive, including with respect to food access, housing stability, and other social drivers. That's why I'm grateful for the opportunity for us to focus on social drivers in our discussion of a safe and healthy return to school in the fall.
Great, and thank you, Lori, for sharing your background and that strong connection between the health outcomes and education and where social drivers of health are an opportunity for us to improve those health outcomes. So before we dive into a few specific plays, I just want to give a brief overview of the checklist for this chapter that includes tips to utilize in order to affect the social drivers of health during school reopening. So the first play is begin to address the impact of institutional racism on education and health by seeking out partners in equity, diversity, and inclusion, and building authentic relationships with your leaders of color from your community. Connect your community to resources for food security by widely distributing food access information to families, or consider working directly with local food pantries. Work with local health and human services agencies to support families enrolling in Medicaid or CHIP by educating families about medical benefits. Connect families or staff experiencing homelessness to housing resources. And lastly, connect families and staff to programs and organizations that support financial security. Now, here's a glimpse of what the full playbook chapter checklist looks like on your screen. And Lori, if you don't mind, can you share a little bit about why it's important to consider social drivers of health as we plan to return back to school and how this specific checklist helps us do that?
Sure, thank you, Flora. Well, we know that there is a direct link in both directions between health and education. Healthy students are better learners, better able to leverage educational opportunities. And we know that students who successfully advance through educational achievement have a greater opportunity for lifelong health and well-being. And when schools and districts have the knowledge and resources that they need to support their students, staff, and family in areas like food access and stable housing, and deeply understand the impact that systemic and institutional racism has on the community's ability to open those doors, all members of the community will have a greater chance to thrive.
Thanks, Lori. And I know there all of the plays and strategies in this chapter and this checklist are really important. But if you had to pick one to start off our conversation, which play would you highlight and what are some of the supporting resources to help with that play and implementing a strategy?
Sure, well, I'm gonna start with play number one, begin to address the impact of institutional racism on education and health. This play is about developing an understanding about the impact of institutional and systemic racism on educational opportunity and health, and committing to counteract them. We recognize that systemic injustices are centuries in the making and won't be solved overnight. But at the same time, we must commit to understanding and recognizing opportunities to change for the better. One immediate opportunity in this area is to understand the impact of institutional racism on school discipline. Learning for Justice is a great organization that offers several resources to help understand inequities in school discipline and their short and long-term impact on Black and Brown students. One promising practice in this area is around a positive behavioral support approach to school discipline. There's a connection between positive behavior supports and using exclusionary discipline like suspension or expulsion as a last resort. It's connected with decreases in inequities, meaning that when, as a last resort, schools are moved to suspension or expulsion, that there is less difference between who gets suspended or expelled. Healthier Generation offers practical methods for moving to supportive discipline through the RISE initiative in an effort to ensure that all students receive the support they need in a healthy school environment. One of those is a 15-minute supportive discipline basics training that can be found in our Action Center at healthiergeneration.org.
Great, and thank you, Lori, for highlighting that really important play and the free resources that that folks can check out to learn more about how to implement this strategy. Now, kind of moving through the checklist, I'd love to hear about another play and some supporting resources that you want to highlight today.
Thank you. Well, I'll dive right into play number 2, connect your community to resources for food security. This play highlights the importance of identifying the unique needs of your community to help them access the right food and nutrition resources. We know that the Child Nutrition Program is a crucial resource in helping make sure students have nutritious food when school is in session. Nutritious food when school is in session. We also know that it isn't enough. Students need to be in households where everyone has enough to eat, where a snow day on a Friday isn't a food crisis. Connecting the school food system more directly to the greater food system is a benefit to students, families, and staff as well. You might consider working directly with a local food pantry, whether hosting a smaller version on site or partnering to improve communication between the local pantry and the school community. Feeding America has links that can help get you started in developing those relationships if they don't already exist in your school community.
Right, and thanks, Lori, for sharing that resource and how folks can get connected to local food pantries and other resources to support with access to food and nutrition. So, lastly, is there, thinking about the rest of the checklist, is there like a third play and resource that you'd like to highlight at this time?
Thank you. On the heels of what's happened in housing through the COVID pandemic, I'd like to land on our last play today, play 4, connecting families or staff experiencing homelessness to housing resources. This play highlights the importance of identifying local opportunities for students and families experiencing homelessness and housing instability. Federal legislation, the McKinney-Vento Act, recognizes that unstable housing shouldn't mean unstable education. Each district has a designated liaison to support children and families experiencing unstable housing or homelessness. And these liaisons can do their work better when the entire school community understands what is available and how to connect to those resources. One of the ways to do this is to create opportunities for your McKinney-Vento liaison to educate parents, staff, and students about what is possible.
Thanks, Lori. And as we wrap, do you have any final thoughts you'd like to share?
Thank you. Schools have long been the center of communities, whether we've always acknowledged them in that role or not. The conversation recentered schools during the pandemic, not just about providing direct child support systems like our incredible child nutrition staff over the past year and a half, but all of the other support connections that run through our schools. With that recognition, that knowledge, I hope we can advocate for the support of our school leaders as they in turn work to address so many aspects of child well-being in ways that some of us may not have considered before the pandemic.
Great. Well, thank you so much for walking us through a few plays and strategies and supporting resources from the Social Drivers of Health chapter. And thank you all for joining us for this conversation. To access the checklist and additional resources, visit the Thriving Schools website using the link on the screen. And thanks again for joining us today, and take care.